Have you noticed the color of your urine today? It sounds like a silly question, I know, but pay attention. This simple observation may be the difference between ignoring a serious problem and acting in time to protect your health. And no, this is no exaggeration. Your body speaks all the time, and one of the first signs that your prostate may be in imminent danger appears in the urine. What comes out of your body is not just residue, it is information. Information on how your kidneys are working, how your liver is dealing with toxins, and especially, how is the health of your prostate. Most men never think about it. You roomed, gave discharge, life that follows. But what few know is that simple changes in the urine, color, smell, frequency, feeling when urinating, may be revealing that your prostate is suffering in silence. It may be the beginning of inflammation, benign growth of the gland, or even the warning to something more severe, such as the risk of prostate cancer. And it all starts with something that many men still insist on ignoring: the signs of their own body. Just imagine, you're living your routine normally, but without realizing it, it has been urinating more often, especially at night. Wake up several times to go to the bathroom. The jet is weaker, feels that it does not completely empty the bladder, and thinks this is normal. You think it's age, but it is not. It's your body trying to warn you that something is wrong. Worse, if you keep ignoring these signs, you may be making room for much more serious consequences than just discomfort. And then comes the detail that no one tells you. The color of your urine can change subtly, getting darker with an orange-yellow, or even having blood traces. It can come with burning, strong odor, or a strange feeling when finishing urinating. And you, once again, think it's just dehydration or a passing discomfort. But what if it is not? What if this is the beginning of something more serious that is settling without you knowing? What if this urine you have ignored for days, in fact, is the silent scream of your prostate asking for help? That's what we need to talk about, because man who cares is a man who lives more. A man who understands the signs of his own body is a man who avoids pain, suffering, surgery, and even problems that can threaten his life. And that's why I'm here, to alert you, to inform you, and to show you exactly which signs to observe in your urine and what to do if you understand any changes. The truth is that your prostate does not scream with words. It communicates with symptoms, and one of the first to appear is exactly in its pee. Stay with me until the end of this video, because you will learn clearly, directly, and without winding what each change in the urine can mean, and how it is deeply connected with the health of your prostate. It doesn't jump anything. Don't leave it later, because the time you ignore it may be the time the problem needs to grow. And when you least expect it, that little change turns into a diagnosis you could have avoided. And if you're here now, it's because you care about your health. You want to live with more energy, more security, and more awareness. And it starts with information. So pay attention, because what I will reveal you now can literally save your prostate and your quality of life. And now that you have understood the seriousness of this subject and realized that your urine may be shouting for help while you live in the automatic, it's time to act. Because it is no use just watching this video if the information comes in one ear and leaves the other. Knowledge is only worth something when it turns into attitude. And attitude begins when you commit the commitment to take care of your real health. So before we follow with the next signs and guidelines that can help you protect your health from your prostate and avoid serious complications, I want to make you a direct and sincere invitation. If this content has already made you reflect, if at some point during this video you thought, damn, it is happening to me, or I had never paid attention to it, so comments here now. Write something simple like, I'm aware of the signs, or I will take care of my prostate. It may seem little, but this comment is powerful. First, because it helps YouTube to understand that this content is relevant, and so it gives this video to other men who are going through exactly the same doubts and risks as you. Second, because you assume for yourself a commitment, and this is the first step for any real change. And of course, if you have gotten here, it's because you are committed to your male health, right? So leave your like now, because it shows that this video is making a difference. It's not just a click button. It's a clear sign that you value content that treats seriously truth and responsibility to man's health. Your like helps this video reach more people and strengthen this awareness movement that, unfortunately, is still so neglected. What's more, you subscribe to the channel and activate the bell, because here we do not escape any subject. Everything that involves prostate, erectile dysfunction, testosterone, habits that strengthen or weaken you, will be treated in front. No taboo, without shame, no winding. If you want to recover your power, prevent disease, and really understand how your body works, this channel is your place. So click register now and already activate the bell to be warned whenever a new video comes out. We are now going to dive even deeper into the details that most ignore, but that may be giving you clear clues that your prostate needs urgent attention, because as I told you, it is not the striking symptom that destroys your health. It is the warning you choose to ignore, and the next sign you need to observe may be happening to you right now. So pay attention, because now the chat will be even more straightforward. Your body speaks to you every day, and one of the clearest and most ignored media is just your urine. Believe me, the color, the smell, the flow, and even the frequency with which you urine are direct signs of what is happening inside, especially when we talk about prostate. The problem is that most men were not taught to observe this. We learned to get up, go to the bathroom, pee, and you're done. Don't look, don't question, don't investigate. But if you start paying attention, you can find that your body has been asking you for help for a long time. One of the first warning signs is the color of the urine. If you start to realize that it is consistently very dark, amber, or almost orange, even when it is well hydrated, it already lights a red light. Of course, in a few days you may have taken less water, have exuded more, and this changes the color. But if this becomes standard, if no matter how much water you take, the urine remains dense, dark, strong, and strange, it is a sign that may be directly linked to renal, liver function, but to your prostate. Another thing that needs to be observed with extreme attention: blood in the urine. Even if it's a trace, even if it's a lightweight spot, even if it only happened once, this is not normal. This is not an age of age. This is not, it must be because I forced it to urinate. Blood in the urine is always a sign that there is something wrong. Could it be a broken vase? He can. Can it be a urinary tract infection? He can. But it can also be much more serious. It may be a sign of prostatitis, injury, or, in the worst scenarios, an initial symptom of prostate cancer. And the frightening thing is that many men see this blood once and simply pretend it didn't happen. They think it's better not to know. But the body does not send warning for nothing. If it appeared, it's because he wants you to look at it. In addition to color, the way you urine also reveals a lot. Did you start urinating with weak jet? Need to make effort to start urinating? Does urine go out in drops or fore and back? This is not normal. This is the kind of thing that is going slowly, like anyone who doesn't want anything. And when you see, it's been living for months and thinking it's just tiredness, or just because I'm older. But in fact, this can be the result of a compression of the urethra caused by the prostate increase. This happens a lot in cases of HPB, which is benign prostatic hyperplasia. That is, the non-cancerous increase of the prostate, but still generates a series of complications if not treated. And there is more. If you are feeling like urinating all the time, especially at night, this is also a strong sign. Waking up to urinate at one time or another, that's fine. But if this repeats night after night, and worse, if it begins to affect your sleep, your disposition during the day, your energy, it is a sign that the bladder is being pressed. Again, possibly for the prostate. And this is one of those symptoms that seem harmless but who slowly destroy their quality of life. Because you sleep badly, wake up tired, get angry, and it affects your work, your concentration, your patience with your family, your libido. It is a silent domino effect. Now pay attention to this. There are men who go through all this and still convince themselves that it is normal. That is part of age. That everyone with more than 50 has this. But that is not to accept age. This is accepting deterioration. This is to conform to a limited life, with a body that no longer responds, with health that will go out in silence. And I don't believe you want it to you. I believe that if you are here listening to it, it is because you want to take care of yourself. You want to understand what your body is saying, wants to prevent something more serious. Another important sign that almost no one speaks. That constant feeling that the bladder never empty completely. You go to the bathroom, urine, but seconds later, you already feel pressure again. It seems that it is not over. This is a direct indicative of prostatic problem. The swollen prostate can prevent total bladder emptying, causing the residue to be there, fermenting, creating an environment conducive to infections, irritation, pain, and more desire to urinate. It is a cycle that repeats day and night, and that makes the man increasingly uncomfortable, not understanding exactly what is happening. And here is one more detail that few notice. strong and persistent odor in the urine. Not that stronger smell when you take supplements or eat a very seasoned food, but that sour, unpleasant, constant smell. This may be related to urinary infections or even the presence of internal inflammation. And yes, the inflamed prostate can be one of the factors behind it. And you smell you realize something different but ignore. Again, because no one has ever taught to look at these signs as real alerts. And that's why so many people find out too late. So pay attention to every detail: color, smell, frequency, flow, feeling of emptying. Each of these elements, when altered, may be indicating a serious imbalance. An imbalance that, if not corrected, will advance. And if you move forward, it can become a much larger problem that requires invasive treatment, heavy medication, or even surgery. And all this could be avoided if you had heard the first alert: your urine. Now tell me sincerely, have you ever felt any of these symptoms? Did you notice any change in your urinary pattern in recent times? Have you woke up more than once at dawn just to go to the bathroom? Have you had to hold on out of shame to stop urinating all the time? Have you ever bothered by the smell of the urine or that uncomfortable feeling of full bladder even after having urinated? Comment here below. You can write just one word, such as frequency, weak jet, without strength, smell, discomfort, or I'm feeling it now. The important thing is to share. This shows that you are on, that you are paying attention to your body. What's more, this can help other men who are going through the same thing but are ashamed to speak. Together, we break this silence and begin to really take care of our male health. These symptoms you may be feeling: weak urine in drops, altered color, strange smell, constant desire to go to the bathroom, and that persistent full bladder sensation, they don't come out of nowhere. Nothing in your body appears for nothing, especially when we talk about the health of your prostate. This is what you may be ignoring as a simple discomfort, a side effect of age or stress. In fact, it can be the beginning of a much more serious process. And the more you use it, the more the problem sets in, intensifies, creates roots, until it reaches a point where treatment is no longer so simple, and the consequences become part of your daily life. One of the main reasons behind these symptoms is what we call benign prostatic hyperplasia, or simply HPB. It is a technical name that scares few people because it comes with the word benign. But make no mistake, the fact that it is not cancer does not mean that it is not dangerous. HPB is the abnormal increase of the prostate, which happens naturally in many men, especially after the age of 45. The problem is that this growth presses the urethra, hinders the flow of urine, generates that urgency to run to the bathroom, and gradually compromises its quality of life. Many men with HPB live with constant discomfort, wake up 3-4 times a night to urinate, feel pain when trying to empty the bladder, and yet do not seek help. They think it's normal, which is age, that every man goes through this. And that's where the danger lives, because ignoring these signs is what transforms something treatable into something chronic. The swollen prostate will not disenhole on my own. And if you keep feeding the same habits, physical inactivity, poor diet, exaggerated alcohol consumption, and lack of preventive tests, which could be resolved with a lifestyle change, may end up requiring surgery. Another problem that may be behind these symptoms is prostatitis, which is nothing more than inflammation of the prostate. And here it gets even more complicated because prostatitis can be caused by bacteria, viruses, or even toxins accumulation and fluid stagnation. This inflammation can manifest in many ways: pain when urinating, burning, mild fever, pain in the perineum region, discomfort during ejaculation, and even sperm changes. In some cases, prostatitis may be acute, suddenly emerging and intensely, but it is often chronic, evolving slowly, dragging on for months or even years without a clear diagnosis. And why is she so treacherous? Because symptoms vary from man for man. In some, it may seem just a light discomfort. In others, it may seem like a common urinary tract infection. And in many, it passes beaten. But while you think everything is fine, inflammation is there, affecting the functioning of the gland, impacting semen production, interfering with libido, and weakening the quality of erection. Worse, constant inflammation anywhere in the body, including prostate, is fertile ground for the development of more serious problems. And this is where the most sensitive point of this conversation comes in: prostate cancer. Yes, it can also manifest with symptoms similar to those we have spoken so far, and that is the problem. Because a lot of people think that feeling just light discomfort, it can be nothing much. But prostate cancer, especially in the early stages, can give soft signs. Changes in urine, weak jet, occasional blood, constant will to urinate and incomplete emptying. Many men only discover cancer when it is already advanced, and it is not for lack of warning. It is for lack of listening. It is for fear of taking an exam, out of shame, by pride. And when they finally go to the doctor, the tumor has advanced, the treatment is more aggressive, the chances of healing are lower, and the larger sequelae. Do you realize how everything is connected? The symptoms you feel now can be just the top of something that has been forming for years. And when you ignore, you give room for it to grow. Give time for the disease to develop. It gives freedom to something that was reversible to become irreversible. And this is not an exaggeration. This is the reality of thousands of men who today live with severe limitations, both physical and emotional, simply because they have not paid attention to the signs of their own body. The prostate is small, but the damage it can cause, when in imbalance, is giant. And you don't have to wait for your body to scream in pain. You don't have to wait for the sexual power. You don't have to wait for the well-back to take action. You can start now, starting by recognizing these urinary signs, understanding that they are not normal, that urinating with difficulty, burning blood, or all the time at dawn is not just part of aging. It's the body telling you, hey, there's something here that needs your attention. And more than that, it is to understand that the health of your prostate is directly linked to your vitality as a man. When it goes bad, it all starts to go down. You feel weaker, less productive, more annoyed, farther from your partner. And this is reflected in your self-esteem, your energy, in your presence. Because virility is not just about sex. It's about feeling good about yourself, feeling in control, feeling whole. So now that you have this clarity, I want to invite you to stop and reflect. Have you had any of these symptoms? Have you felt something was wrong but preferred to ignore it? Have you ever bothered the way urine but pushed later? If so, comment below. Write a phrase like "I identified with it" or just the word "urgent." It may seem small, but your comment may be the push that another man needs to look more carefully to himself. And if you know someone who is going through it, share this video. We can save lives with information, truth with attitude. If you have identified with any of these signs we talk here, dark urine, weak jet, full bladder feeling even after urinating, burning, blood, a constant desire to go to the bathroom, or any other symptom that looks out of normal, the last thing you should do is panic, but also under no circumstances should keep ignoring. The body does not send warning by chance. And now that you have this knowledge, now that this truth has been thrown in your face clearly, your responsibility begins here. The first step you need to take from now on is to consciously begin to observe your own urinary standards. That's right. It may seem exaggeration, it may seem strange, but it is essential. Start paying attention to your body. What time do you feel most want to urinate? How many times do you wake up at night? Has the urine have shown changes in color? Is it denser, more yellowish, more orange? Do you feel pain or discomfort when urinating? Do you notice any stronger and more different smell? Is the jet strength the same as before or weaker? Do you finish urinating with the feeling that it is not over yet? These questions need to be asked every day. It is as if you become your own observer, your own ally in the early identification of any change that is indicating that your prostate is collapsing. Write down this information. Yes, write down. Use a notebook on your phone, whatever is easier for you. The important thing is to start drawing a pattern. P or K many times when symptoms slowly appear, we get used to it, finding it normal. But when you write it down, you see clearly what is changing, what is repeating yourself. And this is gold for when looking for medical help. And speaking of medical help, this is the second step, and it is unavoidable. You need to look for a urologist. It's not for tomorrow, it's for now. Nothing replaces an assessment made by a specialist. And as much as there is a lot of prejudice and resistance among men, you need to understand once and for all that rectal touch exam and PSA examination are not a sign of weakness. They are a sign of intelligence, of responsibility, self-care. A touch of 10 seconds can detect changes in the prostate that no other exam can be seen with such precision. And PSA, that simple blood test, is one of the most effective ways to monitor the levels of a protein that, when high, may indicate inflammation, benign increase, or even cancer. There are a man who only goes to the doctor when he is feeling unbearable pain, when the problem has already become a severe diagnosis, when the options are already surgical or with severe side effects. And do you know what hurts more than the exam? The guilt for not doing anything when it was still time. So if you're here, watching this video, feeling touched by all that we've talked so far, use this energy to make your appointment. It doesn't matter if you have never been. It doesn't matter if you are ashamed. It is important that you are alive and healthy to enjoy life with pleasure, power, and dignity. Now, along with this attitude of seeking a professional, comes the third step: immediate changes in your lifestyle. This begins with something that seems simple, but is deeply transforming: hydration. Drinking more water is the most basic and most powerful thing you can do for your prostate. A hydrated body works better. The bladder empties more easily. The urine comes out clearer, lighter, more fluid. The risk of infection drops. The elimination of toxins improves. It's like lubricating the system, allowing it to work effortlessly. Drink at least 2 liters of water a day. If you can, distribute throughout the day, and especially replace inflammatory drinks such as excess coffee, soda, artificial juices, and especially alcohol. Alcohol irritates the prostate, increases inflammation, affects the liver, and impairs hormonal production. Also, start reviewing what you are putting on the plate. Foods rich in saturated fat, refined sugar, sausages, and fried foods are a silent poison for its urinary and reproductive system. Change this with antioxidant, anti-inflammatory foods that help your body protect themselves. You don't have to become a nutritionist, you need to start with the simple. Less crap, more real food. Fruits, vegetables, seeds, foods that strengthen the body and protect the prostate. All of this will help improve your circulation, energy, and sexual power as well. Because everything is connected. And you know why? Because taking care of the prostate is like preventing a fire before the flames start. It is anticipating. It is seeing the smoke and understanding that if you do nothing, the fire will spread. And after the fire catches, erasing it requires a lot more effort, investment, and often leaves scars. But if you act on smoke, if you take care before, the damage is avoided. And it's exactly this kind of vision that you need to cultivate now. The vision of a man who does not expect the worst to take care of himself. A man who values his life, his power, his intimate health, his quality of life. You deserve to live with energy. You deserve to live safely. You deserve to go to the bathroom without pain, without fear, without shame. You deserve to lie down at night and sleep all night without having to wake up 5 times to urinate. You deserve to have relationships with confidence, with pleasure, with presence. You deserve it all. But that only comes when you act, when you get out of ignorance and enter the conscience, when you transform information into practice, when you exchange fear for attitude, when you understand that your health is not a detail, it is the basis of everything. So now answer me. Will you keep ignoring what your body is saying, or will do what needs to be done? Comment down here with a word that represents your decision today. It can be conscience, action, I will take care, consult a urologist, or even, I start now. Write this, because in addition to registering for yourself, you help this video come to other men who are living the same thing, and you show that you are here not only to watch, but to be part of this transformation. The decision is yours, and it starts now. If you arrived until the end of this video, congratulations. This shows that you are a man who does not escape the truth, who is really committed to your health and willing to face what most prefer to ignore. And this is the type of attitude that changes lives. Now, I want to make you a direct and objective invitation. Subscribe to the channel right now. Here is your space to understand all about male health, prostate, sexual power, longevity, and vitality. Every week has new content. No winding, no taboo, no filters, just the truth you need to hear. If this video opened your eyes, if you reflect, then leave your like now, because it shows YouTube that this content is relevant, and it starts to recommend to other men who are also having to hear it urgently. And do the following. Comment down here the phrase, "Now I take care of myself." This is more than a comment. It is a commitment you assume to yourself, and it further strengthens this channel, engage this content, and helps this message to where it needs it. Oh, and you don't leave the video yet. Click on the next video that is appearing here on the screen now, because there I will show you other silent signs that your body gives when your prostate's health is at risk. What you will find out can avoid headaches up front. I see you there.